In this short video, I'm going to demonstrate child's pose. And child's pose is a nice relaxing pose. You can do this in between standing postures or in between seated postures within the wider class if you want to lower the intensity of the class or the one-to-one clinical yoga session at any time. You can also do it as a restorative pose at the end of the class or a more calming pose at the beginning of the class. Now, essentially with child's pose, we've got 2 hand positions and we've also got 2 leg positions. But we need to think about the ankles. An awful lot of people might not have full mobility at the front of the ankle joint here. So if they find it uncomfortable sitting on their heels, then when we're in child's pose, it might be useful to place a rolled up towel underneath the front of the ankle, or you could use a bolster underneath the front of the ankle. So here I've got a bolster and I'm just placing it underneath the front of the ankles there to take pressure off as I sit back on the heel. Also, if your client can't get their bottom all the way down to their heels, then we could use a block or a couple of blocks underneath the bottom as well. As they sink back, they're still going to be feeling a stretch in the quadricep area, even if they've got a couple of blocks there, if their bottom won't go all the way down to the heels. So just bear in mind the flexibility at the knee and also the flexibility of the ankle, and make adjustments accordingly there so that your client feels nice and supported in this posture, which is especially important because it's considered a rest or a restorative posture. So we can come into child's pose from that tabletop position where we've got those wrists underneath the shoulders, fingers nice and stretched, and the knees underneath the hip. Now, if we're doing the knee together variation, what we're going to do is bring those feet together. And then as we breathe out, we're tucking the tailbone underneath in order to round that lumbar spine a little bit further. And we're stretching those arms out in front of the head. And then ideally, we're trying to relax that forehead down to the mat. If the head doesn't go all the way down to the mat, then again, we could place a block here to rest the forehead onto. So in this position, with the knees together and the feet together, we're getting more spinal flexion as we come into our child's pose. We're really lengthening those arms out in front. The alternative arm position for child's pose is here. So absolutely, we could spend a couple of breaths in this variation of child's pose, anywhere 3 to 5 breaths or longer. And then we could take those arms down to the side of the body into that alternative position and spend a few more breaths in this position. The other variation for child's pose is with those knees apart. Now from here, this can be more comfortable, especially if you've got clients with a little bit more bulk around to the front, or if they want to get deeper down into the hips and they want to have more flexion at the hips rather than flexion in the spine. Now in this position, the upper body is coming down in between those legs, but there might not be quite as much pressure onto the front of the ankles because of that knee position, and there's more space for the upper body in between these legs. And again, we can either have those arms forward or have those arms down to the side of the body in this alternative child's pose. Then as we come out of the postures, we press the hands into the mat and then just pull through those arms as you come back up into that tabletop position. And it's quite nice in a warm-up sequence to combine our cat and our cow posture with our child's pose. And we could do a couple of those different versions of the child's pose in that warm-up sequence, either with the knees together and also with those knees wide. So we're creating that movement in different parts of the back. So that was our 2 different variations of our child's pose, one with the knees wide and one with the knees together. And with the knees together, we're getting more spinal flexion, and with the knees wide, we're getting more hip flexion. We can also have those arms in that long position or those arms down to the side of the body. Thank you.